My name is Dr. Deborah Wilson, and I'm here to talk to you about SculpSure. SculpSure eliminates fat. It's called laser lipolysis. So SculpSure is based on laser technology, and the little tiny laser beams bypass the skin and break up the fat cells. So you have a finite number of fat cells. And once fat cells are eliminated, say 25, 50%, 75% of fat cells in a certain area are eliminated, they can't come back. You can't grow new fat cells. Now, any fat cell can get big and it can get small, it can plump up or get skinny, but you can't grow new fat cells. So the laser, as I said, bypasses the skin. And if you look at a fat cell, it is round like a balloon. And what the laser does, if you look at it under electron micrography, it puts little tiny holes in the fat cell, and then the contents, the long chain fatty acids or the fat, just kind of seep out. So it's very impressive to look at these things under the microscope. So what we do for patients who have areas of fat, this is not appropriate for someone who's really obese. Somebody who's obese needs to lose weight. Maybe they need to have plastic surgery, an abdominoplasty, or something along those lines if it's extreme. But for patients who are just a little bit overweight or perfect weight, but they have tiny areas, small areas of fat deposition, this is perfect. We strap on frames, and then we have 4 applicators that sit on the frames and fire these laser beams into the tissue. It really does bypass the skin. You'd be surprised. It's only a little bit pink at the end of a treatment. And it breaks up 25% of the fat cells under the applicators in each 25-minute session. So 3 25-minute sessions gets rid of 75% of the fat under the applicators. So we can treat the belly, flanks, bra line fat, inner and outer thighs, upper arms. We can treat a variety of body areas and get rid of the fat. Now, it's not instant gratification, because think about it. You're firing laser beams, you're putting holes in the fat cells, and the contents seep out, but it still takes up space. So your body has a mechanism, kind of a garbage collecting mechanism. Macrophages come in and they break down the contents. They break down the long chain fatty acids, and then you excrete them out. So if you are someone who just has, annoying areas of fatty deposition, SculpSure is perfect for you. As I said, it's relatively comfortable. You get to decide how much energy we apply, because it feels a little warm. So if it feels too warm, we reduce the energy. If you feel like you can tolerate it, then we up the energy, and it just, the more energy, of course, that we place on the tissue, the more fat cells you're going to get rid of. So we generally, as I said, recommend 3 treatments about a month to 6 weeks apart, and this will get rid of 25% of the fat in each treatment, which equals 75% of fat cells that can never come back. So if you're interested in this and you're not interested in liposuction, you don't want to go under anesthesia, you don't want to have incisions, SculpSure is really something you should consider. Thank you very much.